expect there will now be a lot of people resistant to get AstraZeneca because of this nasty guidance? In that situation, what would we do with the extra doses? Are you worried that these doses could now be wasted?
Yeah, so not yet, no. I think, this is an attempt to try and give people up-to-date information about what's going on out there. As I've said, it's not definitive. And we know there are many people who made that very important choice about receiving a vaccine. And they made the choice to receive AstraZeneca, and we can be assured that that was a good choice to make. The vaccine is safe and it works, and many people want to ensure that they have the same vaccine for their second dose. But this does tell us that it is certainly a perfectly good choice to mix and match as well. And we have increasing evidence of that. And it may, in some people, stimulate a stronger, perhaps more longer-lasting immune response. So you may get the best of both worlds out of that. But we don't yet know that for sure. And I would just say, as I've been saying all along, there's no wrong decision here. These are equally effective. And you can make the decision based on your own personal beliefs about the vaccine that you chose and the reasons that you chose that vaccine, or you can choose to use an mRNA vaccine if you have concerns about AstraZeneca. So we have a limited supply in pharmacies, and it's been going very well. I know a lot of people have safely got their second dose of AstraZeneca vaccine, and it's about half and half right now with how we're going, and we are titrating the vaccine that we're bringing in to make sure that we can meet the needs. And I know pharmacists are reaching out to people, and we've sent around a little survey as well to try to better understand people's intent for receiving a second dose of AstraZeneca or a Pfizer or Moderna vaccine. And we've been trying to titrate the vaccine that we have coming into that.
Richard, do you have a follow-up?
Yeah, the two concerns I hear about most now since this news came out a few hours ago is if you're double dosed with AstraZeneca, will you be able to travel to the United States? We've already seen this Bruce Springsteen show where the guidance says that AstraZeneca is not on the list of vaccinations they would accept for admission. So are you concerned that there may be travel issues for people who've received AstraZeneca? The other ones are people who you made the point earlier about a booster. They're asking now, can I get my Pfizer or Moderna in the next few weeks to offset the two AstraZeneca I've already received? So what do you think about the travel piece, and is there a thought to allow people just to get that mRNA very soon after a second AstraZeneca dose just to be sure?
So maybe I'll start with the second one, and there's no evidence that, one, it's needed or that it provides any additional benefit to get an mRNA vaccine within a short period of time after receiving the AstraZeneca vaccine. We know from real-world experience, so that's the vaccine effectiveness, that shows that 2 doses of AstraZeneca in the UK, the vaccine effectiveness after 2 doses of AstraZeneca was exactly the same as after 2 doses of mRNA vaccines. So they work, they protect you for a long, that part we don't know yet. And that's where a booster may come in. We need to look at what happens as we go into the fall, and it may be months from now that we'll find that immunity decreases with one or the other combinations of vaccines, and it may decrease with all of them. There's studies going on both in the UK, here in Canada, in the US, looking at intervals as well. And it may be that people who got the vaccine at a shorter interval may need a booster dose sooner. So those are all the questions that we don't know answers to definitively yet, but that we will be following. So if you got 2 doses of AstraZeneca, you can be rest assured you got a safe and effective vaccine, and that we will be monitoring that effectiveness over time. And if you need a booster dose, we'll be able to provide that to you. So I don't think people need to be concerned about that in the short term. We'll be watching all of that very carefully in the longer term. In terms of travel, we have been working internationally, and of course with Canada is leading this, and we are feeding into that. And our advice, our expectation, and what we are hearing from countries around the world is that it'll be WHO-approved vaccines will be the standard that someone will need to meet. And yes, we are hearing, of course, that mixing or matching is going to be accepted in most countries around the world. These are details that are still in flux. We don't know the answers to everything yet, but we have heard from at least from my colleagues in the U.S. that AstraZeneca will be one of the vaccine combinations that they will approve. But that doesn't mean that certain businesses or certain, in this case I understand it was the concert venue itself that made those decisions for reasons that I don't know. But we do expect that it will be the standard that WHO sets that allows us to have a measurable standard around the world. And all of the vaccines that are approved for use here in Canada and all the combinations are approved by WHO as well.